So I think in the field of non-muscle-invasive bladder cancer, one of the novel approach in doing a surgery is by en bloc resection of bladder tumor. So basically trying to uphold the cancer principles and resect the tumor in one piece, as compared to conventional TURBT in which we try to resect the tumor in a piecemeal manner. So basically, we did a randomized trial, 13 centers in Hong Kong, 350 patients, and we found that en bloc resection can actually reduce the one-year recurrence rate from 38.1% to 28.5%, and particularly useful in patients with single tumor, 1 to 3 centimeter tumor, TA disease, and also in patients with intermediate disease. So we actually advise that en bloc resection first approach should be considered in all patients with bladder tumors of less than 3 centimeter. So I think the key message as a surgeon is we should try to optimize the surgical procedure, the resection quality. So we must really adopt the en bloc resection approach in all cases as far as it is feasible. But the second thing is in the post-hoc analyses, we also found that after a good surgery for upfront cancer control, and then followed by intravesical BCG therapy as an adjuvant, actually we observe a one-year recurrence rate of just 5% in patients with high-risk non-muscle-invasive bladder cancer. So it kind of shed some light showing that good surgery plus a good adjuvant, actually we can achieve a cure in many patients with bladder cancer, and this should be the future direction. And of course, in the field of surgery, the other thing is how can we design or develop new tools in facilitating the en bloc resection procedure. So I did also talk about a novel robotic system which can be used transurethral. So instead of having a resectoscope, now we have a two-handed robotic approach in excising a tumor. We did a first-in-human trial last year. First 6 patients, 12 bladder tumors, 100% success rate. Detrused muscle was obtained in 100% of the cases, and there is no grade 2 above complications, and the results are quite good. So we're expanding to phase 2 of the first-in-human trial, and hopefully we'll get the FDA approval later this year. So I think there are many attempts trying to move the field forward, and we're really excited about it. So I think en bloc resection is a surgical technique. So basically using the same instruments like a bipolar resectoscope or laser, a holmium laser, thulium laser, etc. You can pretty much do en bloc resection immediately. So it can have an immediate translation as soon as you're willing to learn and perform the procedure. And I think there's increasing evidence show that en bloc resection works in terms of high quality specimen, but also in terms of oncological outcomes. And therefore, we actually launched the global en bloc resection registry. Already over 100 centers joining. We have recruited more than 3,500 patients, so the momentum is there. So for younger surgeons, I would strongly encourage you to learn about the procedure, try to do it, and hopefully have a wider impact to all patients globally.